My name is Pedro Cervantes. I'm an ophthalmologist working out of Charlotte Eye, Ear, Nose, and Throat Associates. I'll work out of the Steel Creek and South Park offices. So I became a doctor, or I made the decision to become a doctor back in high school. I'm not the typical trend that since I was a kid and I wanted to be a doctor, I just kind of saw that I had a knack for biology and chemistry, and I kind of decided that I would want to try and see what being a physician was all about. And when I started med school, I realized that this is something that I really enjoyed doing. I always knew that I wanted to do something surgical, but at the same time, I wanted to have a rapport, a good relationship with the patient, and ophthalmology just gave me the perfect balance between medical and surgical. During the medical aspect, the patients, it's a great position that I'm in because kind of like their general practitioner, I get to follow the patient through the course of their lifetime, and I really get to know them, their families, their kids. Many times they bring in their own family members, so they get to know me personally and know them, and that has been a great joy. Surgically speaking, it's something that I've always liked, the precision of the eye. Everything is microscopic, doesn't bleed that much, which is really nice, but the satisfaction of seeing a patient to when they weren't able to see and now that they can, just seeing their facial expression is very gratifying to me, and to be able to give them the gift of sight back is something that I truly am passionate about, because I believe that most patients view their sight as their most valuable sense, because that's the way they see life through. So an ophthalmologist was just the right fit.
School.
So I did my residency at Northwestern University in Chicago, and I did a glaucoma fellowship after. And the reason why I chose glaucoma is because even though it's a progressive chronic disease, there are things that we can do to try and minimize the visual loss, which is one of the main causes of permanent blindness in the world. And if we can give patients, or at least prevent them from going blind, is a great gift that we can give them. The other thing that I do is cataract surgery, and cataract surgery is a procedure, as I've mentioned before, that can give the sight back to a patient. So on the one hand, you can give the patient their sight back with cataract surgery, and with glaucoma you can hopefully prevent them from blindness. So CEENTA is a great opportunity. It's a great place to work because it's a multi-specialty practice in which you have every subspecialty that you need. The eye is a very complex organ that requires a lot of knowledge. You can have a retina specialist at your disposal, or a pediatric ophthalmologist, a glaucoma specialist, cornea. There are many different diseases that affect the eye, and having the availability of having every single subspecialty at your fingertips will give the patient the best care possible. So in my time off, I like spending time with my wife and my twin girls. Once my girls go down for the night, I enjoy cooking with my wife, spending time at home, and but on weekends we all like to explore new places, travel. We enjoy spending time outdoors. We enjoy taking hikes and playing tennis.